Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about decalcification, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. It will be focused on the third subsection of the specialist portfolio called decalcification. I will discuss knowledge requirements, competence requirements, reflective statement, evidence of achievement, Q&A suggestions, evidence ideas, and some helpful tips to make candidates' portfolio really good. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the third subsection of the first section: tissue preparation techniques, decalcification. The knowledge requirement explains what knowledge is expected of the candidate in relation to the relevant subsection. Candidates should be able to demonstrate their knowledge at the specialist level. Think about what knowledge they had as a Band 5 BMS. How would that differ to the knowledge of a Band 6 BMS? That specialist level of knowledge would allow the candidate to troubleshoot, problem solve, verify or validate. The first knowledge requirement is homeostatic regulation of calcium levels. Candidate needs to have the knowledge and understanding about the homeostatic regulation of calcium level. You could ask the candidate what homeostatic regulation of calcium levels is, why is calcium regulation important, and which are the key hormones involved in calcium regulation. When addressing this knowledge requirement, candidates should consider the role of calcium in nerve transmission, muscle contraction, blood clotting, bone health, how small fluctuations can disturb functions, hypocalcemia, hypercalcemia, role of parathyroid hormone, vitamin D, calcitonin, role of kidneys, bone, intestines, parathyroid and thyroid, and the feedback loop. The second knowledge requirement is principles and practice of decalcification. Candidate needs to have the knowledge and understanding about the principles and practice of decalcification. You could ask the candidate to explain what is decalcification, how it is performed in your lab, what the principle and practice of decalcification is, and why it is performed. When addressing this knowledge requirement, candidates should consider methodology, reagents, speed of action, endpoint testing, reasons behind decalcification, the effects of decalcification on further testing and diagnosis, and so on. The third knowledge requirement is different decalcifying solutions and their uses. Candidate needs to have the knowledge and understanding about different decalcifiers and their uses. You could ask the candidate to state what solutions can be used as decalcifying agents, when would they be used, what their advantages and disadvantages are, how they work. When addressing this knowledge requirement, candidates should consider various decalcifying solutions, their mode of action, pros and cons of various solutions, situations when each reagent is used, their speed of action, their effect on subsequent analysis and diagnosis. You could also create a table for them to fill in the necessary information. The fourth knowledge requirement is risks and hazards associated with the use and disposal of decalcifying agents. Candidate needs to have the knowledge and understanding about the risks and hazards associated with decalcification. You could ask the candidate about the risks and hazards associated with use and disposal of decalcifying agents, methods of safe storage and disposal of decalcifiers in your lab, about ways to minimize risks and hazards associated with decalcification. When addressing this knowledge requirement, candidates should consider health risks such as irritation, corrosion, carcinogenicity, or allergy risks associated with decalcifiers, tissue damage, incompatible reactions, environmental hazards, regulatory compliance, protective measures like use of PPE, ventilation, waste storage and disposal protocols used. This links closely to the previous requirement and could be added to the table you might wish to create. The fifth knowledge requirement is when and when not to use decalcifying agents. Candidate needs to have the knowledge and understanding about when to use decalcifiers and when not. You could ask the candidate to name the samples that are routinely decalcified in your lab and why, to name the samples that are not decalcified and why. When addressing this knowledge requirement, candidates should consider samples that are routinely decalcified, samples where presence of calcification has a diagnostic value, effects of decalcification on further testing like HER2 or molecular testing, presence of pathological calcification, samples investigated for metabolic bone diseases and so on. Encourage the candidate to use examples from their practice. The sixth knowledge requirement is pathological significance of calcification in tissue. Candidate needs to have the knowledge and understanding about the pathological significance of calcium in tissue. You could ask the candidate to explain, what is pathological calcification in tissue, to name causes of pathological calcification, what can pathological calcification lead to, what the clinical significance of microcalcification in tissue is and what types of microcalcification there are. When addressing this knowledge requirement, candidates should consider causes like tissue injury, cellular changes, systemic factors such as hypercalcemia, metabolic disorders or genetic disorders, microcalcification, impaired function, mechanical stress, inflammation, cell damage, significance of calcium presence or absence, what this indicates, use of calcium as a diagnostic tool, prognostic value of calcium, trigger for further investigations, association with benign or malignant conditions, type 1 microcalcification and calcium oxalate in benign conditions, and type 2 microcalcification and calcium phosphate in benign malignant conditions. The seventh knowledge requirement is how decalcification may affect the use of subsequent methods of analysis. Candidate needs to have the knowledge and understanding about the effects of decalcification on subsequent testing. You could ask the candidate to explain what methods or analysis can be affected by decalcification and why the decalcification affects further analysis, and how could the negative effects of decalcification on tissue be minimized. When addressing this knowledge requirement, candidates should consider mode of action of decalcifying reagents and how this affects quality of H&E staining, IHC staining, molecular testing, enzyme histochemistry, and event reporting, preventative measures like choosing the right decalcifying agents, monitoring of decalcification, proper fixation prior decalcification, possible tissue washing following decalcification, and so on. The eighth knowledge requirement is relative merits of decalcifying agents used in cellular pathology. Candidate needs to have the knowledge and understanding about merits of decalcifiers. It might be a good idea to create a table for the candidate to fill in. You could ask them to state the merits of decalcifiers, and what considerations they would take into account when choosing the decalcifying agent. When addressing this knowledge requirement, candidates should consider comparison of decalcifying agents such as strong and weak acids, or chelating agents, add example for each, mode and speed of action, tissue preservation, downstream testing merits, urgency of diagnosis, speed calcification, the effects on downstream testing, specimen size and density, health and safety considerations, and so on. Competence requirement is basically a combination of knowledge, skills, and experience candidate needs to perform a job to a satisfactory standard. Candidates' chosen evidence should demonstrate these competence requirements. The following competence requirements need to be met for this subsection. The first competence requirement is prepare and monitor specimens for decalcification, keeping audit trails as appropriate. Candidates should be able to prepare and monitor specimens for decalcification. Does the candidate perform decalcification in your lab? Do they place samples into decalcification correctly? What reagents do they use? Where and how they record decalcification progress? And how they monitor and determine the endpoint of decalcification? When addressing this competence requirement, candidate could consider SOPs, sample types and their preparation for decalcification, reagents they used, record keeping, process monitoring, endpoint testing. The second competence requirement is select an appropriate decalcifying agent for a range of samples. Candidates should be able to select correct decalcifiers for various samples. Does the candidate know about the decalcifying agents used in your lab? Do they know when to use each and why? Do they select and use each decalcifier correctly? Do they know the reasons behind using different decalcifying agents for different samples? Do they know what could happen if they used incorrect decalcifier? Do they know how using incorrect decalcifier could affect the patient diagnosis? When addressing this competence requirement, candidate could consider various decalcifiers used in your lab and how they select and used them, sample types they routinely place in decalcification, effects of various decalcifiers on tissue, reasons why they use different decalcifiers, troubleshooting of decalcification, and so on. The third competence requirement is perform decalcification procedures on a variety of calcified tissues. Candidate should be able to perform decalcification on various samples. Does the candidate know what the routine decalcification procedure in your lab is? What samples can they routinely place into decalcification? Can they perform decalcification process on different types of samples? Do they use different methods of decalcification depending on sample type? If so, do they know why? What methods do they use in your lab to decalcify samples? Do they know how to monitor decalcification process? Do they use endpointing? When addressing this competence requirement, candidate could consider various sample types decalcified in your lab, decalcifiers used, various methods of decalcification, monitoring of decalcification, endpoint testing methods, and so on. The fourth competence requirement is test for completion of decalcification. Candidate should be able to test for the completion of decalcification. Does the candidate know how to establish endpoint of decalcification? What tests can they use to determine endpoint of decalcification? Do they know the difference between those tests? When addressing this competence requirement, candidate could consider types of endpoint tests, accuracy and sensitivity of those tests, methodology used, and so on. The fifth competence requirement is prepare decalcified samples for processing, maintaining records as appropriate. Candidate should be able to prepare samples for processing following decalcification. Does the candidate know what the procedure for processing decalcified samples in your lab is? What processing schedules do for decalcified samples? How do they record decalcified samples are ready for processing? Does the candidate maintain correct records for decalcification? When addressing this competence requirement, candidate could consider SOPs, LIMS, tracking system, proformas, sample size and type suitable for various processing schedules, and so on. The sixth competence requirement is troubleshoot problems which may arise, including root cause analysis, as appropriate. Candidate should be able to troubleshoot problems with decalcification, including root cause analysis. Can the candidate troubleshoot problems with decalcification? Does the candidate know about the common problems encountered during sample decalcification? Would the candidate know how to resolve them? Would the candidate know how to prevent them in the future? Would they know how to communicate issues to colleagues within the lab? Does the candidate keep record of troubleshooting? When addressing this competence requirement, candidate could consider common problems, possible resolutions, corrective and preventive actions, communication, record keeping, and so on. Each section also contains reflective statement which is asking the candidate to summarize their role in the lab in the context with each section. When they complete all the subsections within each section, they will be required to write a reflective statement. They also need to write a personal reflection on their training and why they chose their evidence. To prepare for that, ask them to write a smaller reflective statement for each subsection. What is their role and context of this subsection within the lab? What does their evidence demonstrate? Ask them to write a smaller justification as to why they chose their evidence for this subsection. Also ask them to write about what was their training like when to this subsection. Writing a smaller reflective statement at the end of each subsection will then make it much easier for them at the end of the section. Each subsection also has evidence of achievement. This is a part where you, the training officer, sign the candidate off as competent and fit to practice as a BMS at the specialist level. By doing that, you will confirm that the candidate can work in accordance with local SOPs relevant to this subsection. This will also confirm that candidate has answered questions set by you to test their knowledge and skills relevant to this subsection. And you will also confirm that candidate's chosen evidence demonstrates their competence, relevant to this subsection. The candidate will need to be signed off as competent by an internal assessor for each subsection. They can be signed off by you, the training officer, senior BMS overseeing relevant section, or by the training lead. These are some example questions you could give your candidate to test their knowledge and skills about this subsection. These should be based around the knowledge and skill requirements mentioned earlier. You could ask the candidate to complete tables you created, based on knowledge requirements. You could ask the candidate to complete tables you created, based on knowledge requirements. These are some more example questions you can ask your candidate to complete, to test their knowledge and skills about this subsection. Supporting evidence should be selected by the candidate. It needs to be based around the competency requirements, and be relevant for each subsection. The evidence should allow the candidate to demonstrate their competence in each subsection. It should be specific, and relevant to the candidate's in-house practice. It should also demonstrate candidate's specialist competence. If you would like to see specific ideas for supportive evidence, please have a look at the video for trainees. Link will be included in the video description. I would also like to share with you some helpful tips that can make candidates' portfolio look really good. Ask them to try and present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs, or even videos, if they can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Ask them to try and make it a little bit more interesting to the reader, which will be you, and eventually the assessor. Ask them to try and put themselves in your or the assessor's shoes. How would they like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture 1,000 words. I will make a video where I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also ask them to try and use various types of evidence, not just one type, like case studies, for each subsection. They could use experiments, case studies, annotated results, annotated photographs of them performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation verification evidence, comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Ask them to try and bring in their personality. Ask them to think about the ways they like to learn best. If experimenting, let them perform experiments. If they like troubleshooting, let them perform troubleshooting. Ask them to choose something that demonstrates their specialist understanding, knowledge, and skills, and how they apply this in their practice. And one more thing, ask them to keep the competence requirements in mind when they are selecting their evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the knowledge and competence requirements for this subsection. And I hope you also have a better idea what questions you can choose to test candidates' knowledge. And my final take-home message? Keep those requirements in mind when selecting questions and guiding the candidate. Bye for now.